When I first started, even thinking about what to say at the beginning of this to kind of tee up the episode, in my notes I had, we're going to be looking at this from the, kind of through the eyes of a member, and then I put slash patient, and then I put slash beneficiary, and then I put slash customer or consumer, right? Like there are so many roles I feel like a person plays as they go through this journey that complicates it, right? We're not just a customer of a retail store. In healthcare, you're a patient of this organization, a member of that organization, a beneficiary maybe to the government, and as you're picking a Medicare plan. Anyway, it's I feel like we kind of inject some identity crisis into the problem. Heidi, as that member of a health, or that sorry, as a patient of the healthcare system, typically is also a member of a healthcare plan, right? They sometimes become the middleman, right, between those two fragmented organizations. Can you kind of paint that picture of what that looks like from a pain point perspective?
Yeah, absolutely. I mean, totally agree with what was said. I think one of the biggest pain points is that whether you want to say member, whether you want to say patient, they experience healthcare as one system. But a lot of times we are kind of operating as a multiple disconnected organizations. So we think about it a little bit differently. I think health plans are thinking in terms of benefits, in terms of, authorizations, networks. And then you've got the provider piece thinking about clinical care and their workflows. But when we think about the member, they truly don't, distinguish between those two different things. They just want to know, was it easy to get the care that they need? Or did we make that difficult for them? So I think when that fragmentation exists, that's where the member's kind of left to be that coordinator. So they're making multiple phone calls, they're repeating their story, they're trying to understand. They might be getting conflicting information from the plan, from their provider, or like navigating delays between information that needs to flow between providers and plans. And I also think, it's not always tied to like one big failure or one catastrophic moment. It's kind of, I think it's a lot of little things that compound. So you call in and it's like you need to call your doctor, or the doctor says you need to call your plan. Then they go to the pharmacy and it's their medication's not covered. So those things might be small individually, but then when we collectively bring that all together, that's where they're starting to lose trust, I think, in the entire system. And we underestimate how much that impacts perception. So you're looking at a physician, they might have an excellent physician, but if their prior authorization's delayed, their benefits are confusing, that starts to even spill over into their provider relationship. And then I think the reverse is true too, right? Like poor provider communication, that impacts their perception of the health plan. So from their perspective, I don't think there's a payer experience and a provider experience. It's their healthcare experience, their human experience. And I think that's where we still have some work to do there.